Welcome to the Situationship, and today I'm with the one and only Dr. Sandra. Anytime you see Dr. Sandra in the Situationship room, we're about to have some very heavy conversations surrounding sweat, of course. The perception that is out there is we are more focused on one component, which is hyperhidrosis. So when we talk of excessive sweating, people tend to lean on, sweaty hands and feet, and they leave out all those other areas which are important for us to tackle and talk about: the craniofacial, axilla, hexals, hyperhidrosis. But what about all these other sweats? That's one thing.
Yeah,
Number two, another thing that came in mind when I was doing the interview, I realized that secondary generalized hyperhidrosis, secondary sweating, is never ever discussed in depth. And so I thought to myself, we should focus more the same way we do on hyperhidrosis. We can also focus on all these other sweats, but we can also shift gears and start touching on SGH. Throughout my research, I saw, both medical conditions and oral medication prescriptions that can lead to excessive sweating. But now in secondary sweating, there's a list of over 400 prescription medication, and it blew my mind.
I, I get that.
Without further ado, let us start with secondary generalized hyperhidrosis. We know it's a side effect to a medication or an underlying medical condition. So, what are some of these medical conditions that can lead to secondary sweating?
Yeah, the list is actually quite long, but I think I can focus on the most common ones. But sweating, always when we investigate hyperhidrosis or sweat issues, we need to rule out that there is not an underlying condition causing the sweating. So depending on the story from the patient and the symptoms that they present, we need to think about different possible conditions that can cause the sweat. And for example, one thing that people actually tend to think about and that can be a cause of secondary hyperhidrosis is, for example, thyroid problems. This gland that we have in the throat regulates a lot of different things in the body, for example, the temperature and as well as sweating. So if you have an overactive thyroid gland, you can become very warm and also experience hyperhidrosis, excessive sweating. And that is actually quite a common diagnosis, especially in women. So that is something we as doctors always try to rule out in the first line of investigation when someone is experiencing sweat problems. And that is something that I know actually a lot of people know about. But then the list is very long. There can be different endocrinological, hormonal problems. We have so many hormones in the body, both the sex hormones like estrogen and testosterone, but we also have a lot of other hormones. And if we have imbalances in these hormones, that can also lead to sweat-related issues. So there's, but once again, what we as doctors do to investigate the sweating depends on the story that the patient tells. Who do we have in front of us? How old are they? Do they take any medication? Do they have any other symptoms? How long have they been experiencing these problems? And what parts of the body are affected? Because we often talk about generalized hyperhidrosis when we talk about secondary hyperhidrosis, but there is also actually a focal secondary hyperhidrosis when you sweat in just a few or maybe even one area, and that is caused by some underlying condition. For example, if something is pressing on a nerve, for example, a cancer tumor or something that can cause excessive sweating just locally. So there are different kinds of malignant conditions, different kind of cancer forms. Is always something that we to think about if we need to rule that out or not. And especially, I remember from medical school, when we talk about night sweats, we always learned in school that that is a serious symptom, and that can be a serious symptom of cancer, especially lymphoma. But then when I started working in sweat clinics, I realized that many people with idiopathic primary hyperhidrosis also can experience night sweats, but we are not so well educated regarding that in med school in most countries, as my experience is. I mentioned thyroid problems, endocrinological hormonal problems, and then, as I said, cancer. Let me see what else. There can be, if you have some problems with your nerves, for example, if you are diabetic and your diabetes is damaging nerves, for example, in your lower body, then you can get compensatory sweating in your upper body, and the body is trying to maintain regulation of temperature. So with time, you can experience hyperhidrosis in your upper body and anhidrosis, I mean no sweating at all, almost, in the lower parts of your body. So there's also a form of secondary hyperhidrosis. So let me see what else comes to mind. As I told you, the list is very long, and some conditions are more common than others. But we as doctors always go to the patient's history, and depending on our knowledge and experience about sweating issues, and as well as our specialty, we can decide on how to proceed in the investigation of the sweating. But this is because it can be a symptom in so many medical conditions. This is why it's very important to see some doctor that has knowledge about this, and also to actually see a doctor, so you don't diagnose yourself at home, because so many conditions can be involved in sweating, and it's really important to rule out the serious ones and the treatable ones.
How about bacterial, fungal, and viral infections? Can they contribute to secondary sweating?
I would say there are different chronic infections, like malaria, for example. It's a parasite, and then we have tuberculosis, it's bacteria, and those kinds of chronic infections can bring you episodes of excessive sweating when the body is very stressed. I wouldn't say that you would go around having just excessive sweating and no other symptoms usually from these conditions, but they can be a part of different kinds of infections. Even if I would say that is maybe not the most common cause of secondary hyperhidrosis.
And how can we tell the difference in terms of the focal areas where an individual exhibits or experiences sweating? For instance, we know the idiopathic, which the PFH, mostly will happen or rather occur on the palms, the feet, and other areas of the body. But when we're talking of secondary generalized, based on the research I've done, they say the sweat occurs in larger areas of the body. So which are some of these areas that we can help us, when it comes to doing our sweat diagnosis to detect this? Could this be leading us towards secondary or primary?
Yeah, first of all, I want to stress the fact that there is actually primary generalized hyperhidrosis as well. So you wouldn't be able to tell completely as an individual if you're experiencing secondary or primary hyperhidrosis. You would need help from a medical expert. But But as you said, the most common form of primary hyperhidrosis is when the sweat is located to the palms, feet, and or armpits. But the form that I was talking about, primary generalized, or I usually call it primary multifocal hyperhidrosis, can actually involve all the same areas that usually are involved in secondary hyperhidrosis as well. So that can be very confusing. And those areas are usually the head, the neck, but it can also be the chest, the back, armpits, and the groin area, and even sometimes the legs and arms. I would say the whole body is most often affected in secondary hyperhidrosis, but can also be affected in this form of primary multifocal hyperhidrosis. So to be sure, you need to see a medical expert. But I would say if you have been experiencing sweat problems from your whole body for many years, and you have not had any other symptoms that you're aware of, that may decrease the risk that there's an underlying condition, because usually with time, other symptoms except for sweating will show. But you can never be sure until you see a doctor about it and maybe have some blood samples run. Yeah.
Do you know of, just on top of your mind, any, like give us about 5 prescription medication that you know that can lead to excessive sweating, mostly secondary?
Yeah. When I talk about side effects or adverse effects from medications, I always need to think about how common is that side effect. And actually, when I talk about side effects, when I talk about common side effects, I always go to the antidepressants, but also sometimes actually anti-anxiety medication as well. And that is a bit of a paradox, because many times when people suffer from hyperhidrosis, that in the end turns out to be primary hyperhidrosis, they get treated with antidepressants, or they get treated with anti-anxiety medication, and they end up having even worse hyperhidrosis. So that is a big problem. And I would say, on top of my head, those are the largest groups that I think about, but I know from experience that many medications can affect sweating. And it's usually, you can have maybe start out with a little bit of more sweating than everyone else, but then it's not classified as hyperhidrosis. But then when you start taking some sort of medication, it increases, and maybe it goes slowly, so you don't even think about it in the beginning. Maybe it was winter when you started taking medication, and then when it comes summer, like 6 months after that, you don't connect the sweating to the medication that you started with. So I think if you are taking several different medications, it would be a good idea to check the list of adverse effects and see if that is listed as a common side effect. Because I mean, even not so common side effects can occur, but it's not that likely. So I wouldn't tell you, for example, to stop any medication that you might need to see if it's causing the sweat, because I hear about that too. People who were prescribed antidepressants and then currently they stopped suddenly taking it because they thought it was causing the sweat, and then they became really depressed but were still sweating. So you need to, if you are suspecting that medication is causing your sweating, you need to talk to your doctor about it, and hopefully they will understand where you're coming from, and you can do a systematic test when you pause maybe a medication at a time to see which one might be affecting your sweating. But don't do anything that drastic, because there's usually a reason where you got the medication in the first place.
I also read somewhere that, but this was some time back, medication that has mercury and sometimes even steroids can have, side effects on the person, and secondary sweating is more prevalent. I don't know how true that is.
The thing about different kinds of metals and mercury and aluminum and things like that always circulate on the web. For example, can we use aluminum antiperspirants, for example, or is it carcinogenic and so on? And I would say that in my experience, mercury or dopamine, I mean, mercury, first of all, is not often included in any large quantities because it's not safe for people. So I would say that that's an issue. Regarding steroids, if we're talking about oral medication, it's a very strong medication, which you should always be careful with. So if you're prescribed oral steroids, you need to be careful with that. But of course, doctors usually don't prescribe that very easily because it's affecting your whole body and hormonal system and sugar, glucose and everything in your body almost. So it's because steroids is actually a sort of synthetic hormone that we treat us with. So that is actually a hormone that we are taking if we take steroids. I'm not talking about the topical form now. I'm talking about the oral medication, but that could affect sweating, yes.
How about the family planning methods, especially for the women, those who are on family planning? Is there any effect in terms of, could there be a side effect from the family planning?
Yeah, that is something. I know it's a problem that all side effects from contraceptives are not always reported, and with as we speak about hormones, it can be hard to. Also, because women have the cycles, you know, it varies over time, so it can be hard to know what is the medication and what is not. But for example, if we talk about women after, I forgot the word now, you know,
Menopause.
Yeah, exactly. But women that are no longer fertile, they sometimes get hormones to treat the sweating. So I wouldn't say that, and those are sometimes the same kinds of hormones that are used in contraceptives, estrogen, for example. So I wouldn't say that necessarily it would give you excessive sweating, but as I said before, hormones are involved in different ways in sweating. So I wouldn't say that we can rule it out either. So once again, when you investigate any kind of medication, you need to be systematic about it. And if you're trying something, never try stop using several medications at the same time. For example, you need to be systematic to be able to rule out a medication if it's causing the hyperhidrosis or sweat problems or not.
Then the general rule of thumb from this conversation is diagnosis. It's the most important thing. The correct diagnosis will give you the correct treatment. Wrong diagnosis, wrong treatment. What will be advice for the hyperhidrosis family, especially those who have secondary generalized hyperhidrosis? How best can you advise them?
Let me just say first that sometimes people who end up with the diagnosis primary hyperhidrosis, they sometimes feel a little bit let down or sad that they say all the blood samples came back normal. They couldn't find anything wrong with me, but I still have my problems. And on the other hand, you have the secondary hyperhidrosis patients where you find something is wrong. And that can be serious or not serious, treatable or not treatable. But what is really important, I think, is to know with the primary hyperhidrosis, if everything comes back normal, then it's usually, and the story suits the diagnosis primary hyperhidrosis, then it's usually a good sign. You don't have any other underlying serious conditions. But of course, if you don't get the proper information, what is primary hyperhidrosis, if they just send you home and say, oh, everything's normal, it's not a problem, go home, and live your life. And they don't confirm, okay, this is primary hyperhidrosis. This is a medical condition. It doesn't show on blood sample, but it's still a medical condition. And there are treatment options. Then, of course, you are going to feel devastated and sad and feel like you're not being taken seriously. So that's the problem for the people with primary hyperhidrosis. And then the people with secondary hyperhidrosis, it's really important, as I told you, because there can be serious and not serious underlying conditions, but it's really important that you get the diagnosis. And if you feel that if you see a doctor and you feel like you're not being taken seriously, then I think you should see another doctor to make sure they really hear you. But usually, what most doctors, in my experience, try to do when they hear about sweat issues, they try to rule out the dangerous things. So that's actually, I don't have so much experience with doctors not doing any blood samples, so just saying, oh, it's nothing, before they checked at least some blood samples and listened to the story. So I think in that way, people with secondary hyperhidrosis, they have it a little bit more easy when they see the doctors, because they're at least listened to and heard. And then when they find something, it's a proof, okay, they really found something. There was something wrong with me. And then you have the primary hyperhidrosis patients that don't get that. They just, yeah.
Well, thank you very much for your time. Truly appreciate you giving us this wonderful information on SGH, secondary sweating. And we will want to bring you back. But this time around, we want to tackle other sweats. I know there is bromhidrosis, chromhidrosis, anhidrosis, hypohidrosis, and the rest, and including fish odor syndrome, fish body odor syndrome.
Yes.
And these are the type of conversations that I want us to go knee deep and talk about, because I promise you there are people out there with some serious sweat issues. So to everyone who's going to watch this video, we are not only focused on one component, which is hyperhidrosis. Hyperhidrosis is like the umbrella of the rest. So we're not only focused on one, we are focused on sweat, and we're going to tackle these topics one step at a time. So thank you very much, Dr. Sandra. I know you're busy, but for giving us these 10, 15 minutes of your time, we truly appreciate. And until next time, how do you say goodbye?
You say, hey då.
I can say that. I'll bite my lips.
Thank you, Martin.
Thank you.
Thank you. Bye-bye.
Bye-bye.